doctor, my penis isn't working, I cannot seem to get it up, I'm not having sex like I used to, I'm not lasting long enough. These are the most common reasons why men would come to see a doctor. Why is my penis not working? Now, the two most common conditions tends to be premature ejaculation and erectile dysfunction. And most men tend to get these conditions mixed up and confused. Now, premature ejaculation is basically ejaculating within 1 minute of vaginal penetration, or as soon as the penis touches the vagina, you find yourself ejaculating straight away. While erectile dysfunction is basically not holding erection long enough for satisfactory sexual intercourse. Now, the main difference between premature ejaculation and erectile dysfunction is with premature ejaculation, you could have strong erections, but as soon as you go in, it's gone within 1 minute. While with erectile dysfunction, most men tend to complain more about semi-erections. Basically, the erection is not strong enough. And even if it is strong enough, they lose it within like 1 or 2 minutes. So men can also have both premature ejaculation and erectile dysfunction at the same time. And this is where it becomes a problem in terms of treatment. Now, when we look at what premature ejaculation is, you've got two different types. You've got primary, you've got secondary. Primary premature ejaculation is something that happens if your very first sexual encounter, you have always had problems with premature ejaculation. Now, with secondary premature ejaculation, maybe you've had previous successful sexual intercourse with your wife, but all of a sudden now you're having problems on vaginal penetration, where basically within 1 minute of penetration, you're ejaculating. Now, what is the problem for this? What is the cause for this? Now, common causes can include something like psychological. Is this anxiety? Is this depression? Is this stress going on? Have you had childhood worries in the past? Childhood trauma, for instance, could be a contributory factor. Then we're looking at medical causes. Could this be, thyroid problem? Could it be something neurological like multiple sclerosis, diabetes? Could it be a hormonal imbalance to do with oxytocin, which is produced by the pituitary gland and is responsible for regulating your LH and FSH hormones? Or could it be a chemical imbalance in the brain like low serotonin levels, which can cause premature ejaculation? And in some cases, no cause is found for premature ejaculation. In terms of investigations, simple blood tests to check your thyroid, brain scan to see if there's any underlying cause in the brain. In terms of treatments can vary from medical to non-medical treatments, and it really depends on the underlying cause. So, for instance, if we look at medical treatments, the most common treatment tends to be antidepressants. Because what happens is antidepressants, they work on the chemical imbalance in the brain to increase your serotonin levels. So if you've got low serotonin, which is causing your premature ejaculation, you would expect antidepressants to be effective. However, antidepressants do not always work for everyone in this case. The most common antidepressants that's used is paroxetine. Paroxetine, is found to be quite effective. It can be used as an on-demand drug, which means you take it as and when you need, especially if you're not someone that has sexual intercourse all the time, or you can take it as a daily drug. Now, side effects tends to be more common if you take it as a daily drug compared to if you take it as an on-demand drug. However, the number one choice for premature ejaculation is actually another serotonin inhibitor called priligy, otherwise known as Dapoxetine. Now, priligy is licensed for premature ejaculation, but it's not available in all countries. Priligy is usually taken 1 to 3 hours before intercourse. It's short-acting. It does the job. It has similar side effects to any other serotonin inhibitor, whether it's your paroxetine, fluoxetine, sertraline, and citalopram. They can cause nausea, vomiting, fatigue, numbness, mood swings, and most commonly, they can also cause erectile dysfunction. So this medication, they help to delay ejaculation as well. Now, in terms of erectile dysfunction, and that is not having erection strong or long enough to have satisfactory sexual intercourse. Again, similar causes can be stress, anxiety, depression. The medical causes could be underactive thyroid, medication such as blood pressure tablets, chemotherapy, for instance, prostate surgery, neurological causes. You had back surgery, back pain, nerve impingement, low testosterone, as in testosterone deficiency can be due to causes such as chemo, which I've just mentioned. It could be due to a problem with your prostate. Enlarged prostate can cause erectile dysfunction. It could be due to a pituitary problem, such as having a tumor in the pituitary gland can also cause erectile dysfunction due to the low testosterone production. Also, it can be due to trauma to the testicle, as well as obesity, which is also known to cause diabetes and low testosterone. So usually you would want to investigate the underlying causes, such as doing blood tests, for instance, checking your testosterone levels, which is usually done early in the morning, because if you do your testosterone levels later than 11 o'clock, usually they tend to be lower than usual. So I would advise doing your testosterone first thing in the morning, which is usually around 8 o'clock in the morning, is when your testosterone production, will be quite high. You want to check for your blood sugars for diabetes. You want to check your cholesterol, because high cholesterol can lead to a deposition of cholesterol plaques in the blood vessels of the penis, which can affect blood flow to the penis. You also want to check blood pressure, because high blood pressure can also cause erectile dysfunction. And in terms of treatment, again, we're looking at treatments like Viagra, which is also known as sildenafil, tadalafil, Levitra, and other new generation, what we call PDE5 inhibitors that are coming to the market. Now, Viagra usually lasts 6 hours, while tadalafil lasts up to 36 hours. So most men who have more regular sexual intercourse tends to prefer taking tadalafil as opposed to Viagra. Most common side effects do tend to be, feeling flushed. You can have low blood pressure, for instance, dizziness, and headaches. Because what happens is basically they dilate the blood vessels because of the release of nitric oxide, into the system, which allows for you to have, more sustainable erection. Other treatments if medication is not working. Have you heard of shockwave therapy? Apparently, shockwave therapy helps to regenerate new blood vessels and it increases blood flow to the penis. And it's thought to be effective in men who find that oral medication is not working. Other options include prostadil injections. Also, you have pellets, as well as vacuum pump erections. So these are different options. If you want more detailed information on medical treatment, why don't you check my videos on erectile dysfunction, as well as my videos on premature ejaculation. One important treatment which a lot of men tend to ignore is psychosexual counseling. A lot of men tend to ignore the stress, the anxiety and depression and rush straight into medication. However, it is quite important to realize that there is always something in the background that's contributing to this problem. So psychosexual counseling is an important element of managing sexual dysfunction. And you can access psychosexual counseling through your doctor, or you can go privately by going online and looking for a certified psychosexual counselor. I hope you found this video useful. Please feel free to subscribe to my channel.